How do you fix low iron ASAP?
If you suspect low iron, act quickly but safely. Low iron can mean iron deficiency or iron deficiency anemia. Testing is key. CBC, ferritin, and transferrin saturation. While you arrange tests, start oral iron. Ferrous sulfate providing about 60 to 65 milligrams elemental iron, once daily or every other day, with 200 milligrams vitamin C or orange juice, and avoid calcium, tea, or coffee around doses. Expect reticulocytes in 7 to 10 days, and hemoglobin to rise about 1 gram per deciliter every 2 to 4 weeks. Full repletion can take months. Seek urgent care for fainting, chest pain, severe shortness of breath, or very low hemoglobin. IV iron or transfusion may be needed. Monitor CBC and ferritin at about 4 weeks. Guidance from the WHO, American Society of Hematology, and British Society of Hematology supports this approach.
Thanks for watching. Don't forget to subscribe, and I'll see you in the next video.